Top of the morning, top of the morning. How's it going out there, world? I hope everybody's having a great start to their day. First of all, like always, thank God for the wake up. You know how it is. Thank God for the wake up. Thank God for the wake up. Thank God for the wake up. Thanks for tuning in. You're tuned into another episode of Talking Cancer, My Journey, My Way. I'm your host, Louis to the A. Lopez, and today I have my wife joining me, Shakura Lopez. Of course, say hello.
Hello.
Yes, sir. And don't forget to say thank God for the wake up.
Yes, thank God for the wake up. Always. Always.
Yesterday, we went to the doctor. We went to go get the results from my latest CT scan. I was supposed to have this about a week and a half ago, and I had to get it postponed because the doctor was sick. So here I am, and here to talk about that and, you know, the results and what they found in those results before we move on to the next step and what exactly is the next step. Right now, as we went to the doctor, we went in pretty, I think pretty calm-headed, level-headed. Because we actually had time to go into the MyChart and review all the notes from the scan ourselves. That kind of helped, you know, just help make today a little easier in what was going to be said, and actually help us prepare with a few questions, things like that. And we just kind of want to bring that to you and just exactly what happened today. So the results of the CT scan, let's start there. You good?
Yeah.
The results of the CT scan, just like the wife and I expected, the tumor in the liver is pretty much the same. It hasn't moved any. It hasn't grown any. And the same thing with
The lymph nodes.
the lymph nodes.
Yeah.
Thank you.
Yeah.
Those are pretty much the same. But now there was something else that we wanted to address in those scans, and we wanted to confirm and find out exactly what that meant before we had said anything to anyone. And we got that confirmation today, or yesterday, excuse me, when we talked to the doctor. And one of the scans, because they examined my chest, my pelvis, and abdomen. And so the one that came up and that was a concern was of the chest.
Yes.
The chest scan came back that they showed some, what's it called? Nodules in my lungs that I guess probably previously wasn't seen. But then again, most of the CT scans, or maybe most of the MRIs and all the other scans that I've had in the past were of just the pelvis and abdomen. So I'm not even sure if they might have even had seen that. But they're very, very small. But the doctor is saying that they're very suspicious. That's the word that they're using. That's kind of nervous, you know what I mean? Because, you know, this meaning, for me, it means that this thing is continually spreading, possibly. And that's just kind of what it means to me. Now, it could be nothing. The doctor did state that, but he stated that it could have metastasized to my lungs, just for the simple fact that it's now in my liver and it's in my abdomen. It's pretty safe to say that it's probably in the lungs.
Yeah, both.
So that's kind of scary, but like I said, we kind of had prepped ourselves a little bit, so the blow was a little bit. It didn't sting as much because we prepped ourselves, somewhat.
Yeah, it stung when we read it.
Right. It did sting, and I had a bad day a couple episodes ago.
It was just really hard to sit with those feelings, like.
Yeah. Things get tough. And, I think going to the doctor for me, and I don't know about for you, but it brings my mood down.
Oh, for sure.
It brings my mood down because I feel absolutely amazing right now. I really do. I have no stomach pains. I have no problem going to the bathroom. Nothing. I feel so freaking normal.
And you look good.
Thank you.
Yeah.
Thank you very much. But then the scans come back and it's a punch to the gut.
Yeah.
Literally. And so, you get in your feelings a little bit and you got to kind of have to pull yourself out of that. But I think some serious questions were asked today. Mm-hmm. Or yesterday. I don't know why I'm just living in the moment still. It's kind of weird. That says a lot when you're still living in the moment. But I think one of the biggest questions we ask, well, what exactly does this mean? A Doc.
Yeah.
Dr. Vu. Is this cancer, what are you saying about this cancer? Is this cancer considered terminal? Because nobody ever really says anything. Everything's like so around the bush. Mm-hmm. And you have to do your own work.
Mm-hmm. Yeah.
Do you feel that way?
Yeah. You have to be very specific. And you did. You asked.
The more and more I dive into this medical field, I find that I have to do my own research so I can ask the questions that need to be asked.
Mm-hmm.
And I don't understand this. I think this is probably the biggest thing that bothers me. And if you noticed the episode before, I was having a conversation about UCSD and them. I'm supposed to understand what they're trying to imply.
Mm-hmm.
And you don't understand these things unless you do all the research, because unless you ask it, they're not going to say it.
Correct.
They're not going to tell you how sick you possibly could be or how anything. So when I asked him today, at least he was honest.
Yeah. Yeah.
At least he was honest. He was like, yes, this is terminal. What does terminal mean? What does terminal mean?
It's not curable.
Okay.
You will pass away from this disease.
Okay. Tough pill to swallow, right?
Mm-hmm.
So through their medical experience, it's safe to say, through their experience and statistics, that this disease will get the best of me if something else doesn't kill me first.
Right.
Right?
Because of the stage it's in.
Right. Because it's metastasized or spread now to other parts of my body. So reoccurring cancer. I think that's really some of the reasons, a lot of the reasons why I sit back and I sit here and I chose to bring this platform up is because before I found out I had cancer, and I stated the other day, I was medically naive to the terminology, naive to about the concerns of health, just naive. I was a little kid learning how to ride a bike for the first time. Honestly. And it has a lot to do with my family upbringing. It had to do with just all of that, coming from a place of not having the most in this world, not having parents to raise me and teach me the things and the fundamentals of life. But yet, from the conversation that I had with the doctors the other day, they're kind of saying without saying that it's my fault, that I'm naive. And so I sit here, trying to get all the knowledge I can to try to help myself go through this period. And my wife is here by my side trying to help me out. And it's some of the hardest things I've ever had to face, looking at this thing and try to remain as positive as I can. Now, the doctor wants me to do treatment. He wants me to get my port put in and start treatment as soon as possible. So we're looking at possibly between now and the next month where I start treatment.
Right.
Part of me still says no. Part of me, my soul says I could beat this thing. I don't know why my soul keeps on telling me this thing, but, and so I am stuck in limbo, even though I put the wheels in motion to get the port done and stuff like that. Is there anything I could add to the visit that we had at the doctor?
Just the other question, like, okay, so if you do chemo and all these host of other pills, I mean, how long are we talking about? Like, few months? And he's like, no, this is for the rest of your life.
Treatment for the rest of my life. Yeah, that's a lot.
So that kind of blew me away. It's like, what? So you're supposed to do chemo for
however long they could keep me alive.
Right.
Yeah, that's pretty much it.
Yeah.
Another tough pill.
That one I haven't fully digested yet. I don't see.
So yeah, it's tough, because I sit here, and I wanna just do what I'm doing, and I have a feeling what I'm doing is gonna work. But at the end of the day, all of it, if it doesn't work, hasta la vista. If I go the treatment route, it could work, but it could also, they're injecting me with deadly medicine anyways, and that could kill me. Mm-hmm. So either way, it's a double-edged sword, and the path is rocky no matter which road I choose. I mean, between that and the side effects and everything, it's a whole nother thing. I want to get into that right now too. But to have to take chemo for the rest of my life, like, that's hard.
Especially with this experience that you had previously.
The last time.
Yeah.
If I had one more dose, I was done. I wouldn't even be sitting here talking to you right now.
Yeah.
And to explain that to the world, where we try to paint a picture of the importance. I think it's really about the importance and the relevance of you listen to what we're trying to tell you. And if you're medically naive like I am, and I'm still learning, dude, ask questions, look up the words, look up what they mean, because they want you to read between the lines of what they are trying to imply. The doctor told me the other day that I should have known what they were trying to say when they said we recommend colonoscopy. You know, if you're not telling me with any urgency why I should get one, you know, or even didn't tell me at all, just I had read it amongst a number of paragraphs, and then on the last couple of sentences you tell me what you recommend. There was no urgency in any of that conversation, but you know, that's their protocol, was what they said. You know, but I don't know. Enough for me on that one and them at the moment. But I will not let this go. I will not let what they said go, because they made me feel like I was at fault. And the more and more I mull that over, the more and more I feel like I'm not sitting on it. You know? You know what I mean?
Yeah.
I'm going to say something. And I'm going to continue to say something until the world knows more about how they are saying they practice and how policies, I believe, need to be changed. And when the way they communicate, because if we're supposed to read between the lines of what they imply, they need to read between the lines and of us not understanding. We are the patient. We don't understand. That's why they are doctors, and that's why they went to school, so they could tell us what the hell they mean. Anyways, I want to move back on because I kind of got off subject a little bit, and I apologize for that. Sorry, babe.
No worries.
I want to talk about some of what they plan on having me on. It's a number of drugs. I'm gonna go ahead and read off 2 of the drugs, and I'll let the wife read off the other 2. She probably should do them all, but I'm gonna give it a go. But one of the drugs that they want to have me on is oxaliplatin. Oxaliplatin simply is just it's an anti-cancer drug, chemotherapy drug. I'm not sure exactly what this means, and I probably have to look it up, or you'll have to look it up later. But it's classified as an alkylating agent, whatever that means. You know, so these are terminologies I still need to look up because I just got the paperwork. But I kind of want to give you an idea of what it is, what it's used for, and the side effects of each drug. And just kind of give you a quick breakdown. So, you know, if you're being diagnosed and you haven't done this research, you know, it's here for you. But oxaliplatin is used to treat colon cancer or rectal cancer that has metastasized. Metastasized meaning spread. If you haven't figured that out by now, that's what that is. And is often used in combination with other anti-cancer drugs. Some of the side effects, though, I don't know, I think the wifey has one that's like super long. And sorry for her, I think I gave her that one. I think I took the easier ones.
You sure did.
I did, but oxaliplatin has some side effects. Peripheral neuropathy. Peripheral neuropathy meaning like numbness, tingling, cramping of the hands and feet, often triggered by cold. This symptom will generally lessen or go away between treatments. However, as the number of treatments increase, the numbness and tingling will take longer to go away. Okay. It also says here that your healthcare professional will monitor this symptom with you to adjust the dose accordingly. So make sure that you are talking to your doctor if the pain is getting out of control, the numbness is getting out of control. It's very important that you relay this information so they could adjust the dose. Okay, you could also probably experience nausea, vomiting, diarrhea, mouth sores, low blood count. Low blood count meaning your white and red blood cells and platelets may temporarily decrease. You might also experience fatigue or loss of appetite. Oxaliplatin.
And that one also puts you at risk for infection, having like the low blood counts.
Yeah, I just said low blood counts.
Yeah.
Yeah, low blood counts, white blood cells, platelets. Yeah.
Yeah, but so it puts you at an increased risk for infection.
Oh, I didn't read a sentence. I apologize.
I'm not correcting you. It's very important to know.
No, I did miss a sentence.
Because he also said that with that side effect that he's also going to put you on an antibiotic.
Yeah, with the increased risk of infection is like anemia and or bleeding. So, don't get a cut because you're gonna bleed out to death. You know what I mean? So another one is, I think it's like four medicines altogether. And these are all done intravenously. So no pills. Everything's going to be done intravenously. Then I have a Cetuximab, also known as Erbitux.
Mm-hmm.
Erbitux. I sound like a fancy tuxedo, but it's called Erbitux. Cetuximab is the generic name, just so you know. And Cetuximab is used for metastatic colorectal cancer, cancer that has spread beyond the colon or the rectum. So from the original point, the original origin of, and squamous cell cancer of the head and neck. It's also used for non-small cell lung cancer and skin cancer. Some of the side effects of Cetuximab is, drum roll please. Oh, this is a big one. I didn't give you the easy one. That sucks. I gotta read all of this shit. You have some skin reactions to Cetuximab. Skin reactions in most people, this will present as an acne-like rash and will develop within the first 2 weeks of therapy. The rash can last up to 28 days after stopping treatment with Cetuximab.
Wow.
Other rash symptoms may include skin peeling, redness, inflammation, and itchy and dry skin. It also says to tell your doctor of any new or worsening rash symptoms, as they may be severe in some patients. Mild topical steroid cream or antibiotics may be recommended to treat this rash. Sun exposure may make rash symptoms worse. No going to the beach? What? That's some bullshit. Sorry. Also, generalized weakness or fatigue, weight loss or poor appetite, diarrhea, nausea and vomiting, abdominal pain, constipation, stomatitis, which is like inflammation of the mouth, low magnesium levels, low blood counts. Your white cells may temporarily decrease, causing neutropenia. How do you say that? Neutropenia?
Mm-hmm.
Neutropenia. This can put you at an increased risk for infection. So this is another drug that could cause infection. You could have difficulty breathing, cough, peripheral neuropathy, liver problems. I already got liver problems.
Oh my God.
This is going to treat my liver? Really? See, this shit don't make no sense to me. Infection, headache, and nail changes. I don't understand why I would take something that's going to give me liver problems if my liver already has problems. See, this shit doesn't make no sense to me.
Right.
And I'm glad I read this stuff. And I'm reading it live with you right now for the first time.
Well, you're taking it for cancer, and then it's going to give you 200 other...
Yeah. You know what I mean? Anyway, babe, can you please read the other stuff? And thank you for your help. I appreciate it.
So the next drug is Leucovorin. Leucovorin is a reduced folic acid. It's used in combination with other chemotherapy drugs to either enhance effectiveness or as a chemoprotectant. It's used in combination with fluorouracil to treat cancers such as colon and rectal, head, neck, esophageal, and other cancers of the gastrointestinal tract. And some of the side effects are allergic reaction, rash, itching, facial flushing, rarely severe, nausea, and vomiting are very rare. Okay, so I guess
that one ain't too bad.
Yeah.
All right.
Yeah.
Hey, 1 out of 3 so far. All right.
Okay, so the next one is fluorouracil, also known as 5-FU. And fluorouracil is a generic name for the trade name drug Adrisil.
I've heard of 5-FU before. It's pretty common.
Yeah. So what fluorouracil is used for? Colon and rectal cancer, anal cancer, breast cancer, gastrointestinal cancers, including pancreas, gastric, which is stomach. We already said anal and esophageal. And then it's head and neck cancer, squamous cell, thymic cancer, cervical cancer, bladder cancer. Yeah, that's pretty much it. And then the side effects are, what are these ones? The following side effects are common, occurring in greater than 30% for patients taking fluorouracil: diarrhea, nausea, and possible occasional vomiting, mouth sores, poor appetite, watery eyes, sensitivity to light, taste changes, metallic taste in mouth during infusion, discoloration along vein through which the medication is given, low blood counts. Your white and red blood cells and platelets may temporarily decrease. This can put you at a increased risk for infection, anemia, and or bleeding. And then there are side effects that are less common, occurring in about 10 to 29% of patients receiving fluorouracil, and those are skin reactions, dry, cracking, peeling skin, darkening of the skin, the hyperpigmentation, hair thinning. You ain't got to worry about that.
Oh, you got jokes, huh?
No, I don't.
I can't stand you right now.
Like when Kalina draws pictures of you with no hair. There's my dad with no hair. Anyways, nail changes, loss of nails, and discoloration.
Yeah.
And then, here's when to contact your health provider. If you have a fever of 100.4, which is weird.
Yeah, which we probably know that already.
Yeah,
so.
That's kind of low grade. So.
I don't know. I mean, reading more and more of this stuff for me, just, I don't know, puts me in another place. Like, dude, that's like putting your body through a bunch of crap. And, you're going to give, I don't even know if this stuff will work. You know what I mean? Like, this stuff is in my liver, and you want to give me something that's going to damage my liver and lower my blood count. All the stuff that I feel like I should be needing,
and now get an
to
infection.
Fight. I mean, don't you think I need these stuff to fight?
Yeah. I mean, you've been building your body up so much. And this is all going to deplete it.
Yeah, I just got back strong. I'm just right now feeling good. My body's now running optimal with my acupuncture. One of the hardest decisions I ever had to make in my life.
Me too. Like, it's not even me that's going to take the medicine. So all I can do is support you on whatever decision you decide to do. I don't even have an opinion or advice or anything. I just sit here and I just don't know. It's just really hard to sit with.
I think we need to go to.
And now I'm gonna cry.
Don't do that, because I think we're gonna go to one of those places where you could break a bunch of shit.
No.
What you think? I think I need to break something.
Maybe you do.
I think I need to break something. Just get out some frustration. Get a sledgehammer and just break a TV and a bat or whatever it is that they got. What is that place called?
I don't know.
I don't know. I'm gonna look that up. I think I need to release some frustration. Anyways, I'm sorry, baby.
There's nothing to be sorry about. It just
is
what it is, and
you know,
it's just hard to sit with. It's hard to watch. It's hard to.
I know, and I told you earlier too. I was like, and I apologize, that you picked a bad apple. I know that's really. But seriously, I
didn't pick a bad
I wish
apple.
I wasn't. I wasn't this guy that was sick. We chose each other to grow old with, and to have that feeling of that possibly not happen. Sometimes it crosses my mind, and I hate that you have to go through this, and I have to put you through this. That it has to be me that puts you through this.
You're really
so I apologize.
You're not putting me through anything. It sucks, the reality of it.
Yeah.
That's all.
I just love you so much, and I appreciate your support and walking with me hand in hand. I truly appreciate the love you have for me.
I really love you.
I really love you too. Anyway, you guys, that's what we're gonna do for today, and I appreciate it. Enjoy your Friday. I hope I didn't bring it down too much, but it's early enough in the day, if I did, where you could come out of it, because we're going to get out of it, and we're going to enjoy the day, and
go to work.
And go to work and handle business and change this mood, because we are going to choose not to live in this, and we're going to choose to overcome this. No matter what decision we make, the mentality is to win. Yeah. We're going to win. All right? And that's what my acupuncturist says.
You will win.
You will win.
I love her.
All right? Thank you, babe, for joining me. I love you to the moon and back.
Ditto.
All right? That's me saying peace.
Love.
1.